Okay, well, welcome for everyone for coming to the webinar. Hopefully everyone can hear me and we will get started here. Um, this is a webinar about thyroid eye disease, and most of what we're going to be talking about is the introduction of a relatively new medication that is, really kind of revolutionized the treatment of thyroid eye disease. And in general, what I want to talk about is TEPEZZA, but we can certainly entertain other questions, especially as how they relate to why TEPEZZA may be good for certain people rather than others. How long it may work, whether it's appropriate for any individual, really requires a consultation. But I think that you'll be able to gather enough information from this webinar that really be able to take home some points. So one of the things that I've been very involved in the investigations of thyroid eye disease for about the last 15 years, and especially the research that's led to the development of TEPEZZA, looking at the IGF-1 receptor. And our center and myself was the principal investigator for both trials that showed how effective TEPEZZA was. And those were published in the New England Journal of Medicine. And more recently, we've just had a journal publication in The Lancet showing the long-term effect and that how most patients continue to benefit from this medication over a period of time, and that continue to show good results. So one of the things that I'd like to do is to kind of go through some of that information and what we can do to potentially answer your questions, and to really to think about things moving forward. So I'm just going to share my screen and walk through a few slides. And I'm going to answer the questions that people have sent in the past. And certainly if you put in your question and answer or in the chat, I'll respond to those live here today. And we've had many people sign up for this. So hopefully, we'll have a few more people will join in as we do, but it is being recorded, and I think it will show up on our YouTube page. And if anyone hasn't checked out our YouTube page, I think that that's certainly helpful for a lot of information. So I'm not the most technically savvy person, but I am going to share my screen and allow everyone to see the screen. And this is some parts of a lecture that I just gave to the University of Pennsylvania about the disease, but we're not going to go and be too technical, but it really is a new era in the treatment of thyroid eye disease. And so this is a little bit about why this drug works, and these are some of the various faces of thyroid eye disease. And you may identify yourself amongst this group because it's varied. And one of the things that's been really important is that TEPEZZA seems to help with all of these very heterogeneous disease processes as part of thyroid eye disease. So that's been a really great improvement for us. And these are all my patients over a period of time, and you can see the disease has affected them very differently. Most commonly, thyroid eye disease is associated with Graves' disease, and about 80% develop that, in females more than men. And the underlying process here is that there's increase around the eye of the soft tissue. So normally from behind the eye, you have the eye connected to your optic nerve and muscles that move your eye all around. And in thyroid eye disease, there's inflammation, expansion, and remodeling within the orbit that really kind of changes this process, fundamentally. And that's part of why the eye pushes forward, and part of why the eye can't move. The muscles become encased in concrete of these fibroblasts, these cells that are around it. And that's exactly what TEPEZZA reverses. And what we found is that no matter whether you have the disease in the very beginning, when the disease process is, getting worse, or in the chronic phase, when there's kind of this constant, but you still have a lot of the symptoms, but it's not getting worse. You may have some day-to-day fluctuations. We found that therapy seems to work in both situations. So I know there's a lot of questions like, will it work if I've had it for many years? Will it work with this? The answer seems to be yes. We have a lot of data. We have a lot of patient experiences. The original trials were tried early on, and that's what the insurance companies focus upon. But we've had a lot of success later in the disease process. So what has TEPEZZA been shown to do? And that's really the important thing is what is TEPEZZA, what is the data that has been shown? Well, it's been shown to reduce the bulging of the eyes. And it did this in about 90% of people. So it reduced the bulging in 90%, and 80% of the people go on and have long-term results without any other therapy. So that's kind of the takeaway. If you're going to remember one thing, that's it. It kind of works on 90% of the people, and 80% it's long-term. So good chances of working. But also people who had inflammation, it reversed that. People who had double vision, over half of those patients had complete resolution of double vision. And it changed the bulging by about 3 to 4 millimeters on average, depending upon where you started. So that's the data. And this is just an example we published in the New England Journal. Patient who was almost going blind who had a 6 millimeter reduction in the bulging after treatment with teprotumumab or TEPEZZA. This is just some graphs showing about a 4 millimeter, 4-point reduction in the inflammation, but the bulging and the eye bulging, how that improves. So here you can see 83%, it's usually about 90% where there's data, compared to very few if you don't take the drug. So really a pretty dramatic response. So just another response of about 3 to 4 millimeters in proptosis. And I like to look and get MRIs of patients, and we've done volumetric, analysis, shows that there's shrinking of the muscle. This patient actually flew from Australia, and a lot of my patients fly in for the infusions even currently, and they had shrinking of the muscle, and the muscles shrunk, and she was not able to see without seeing double vision, and that went away entirely. And also her eyes moved back 5 millimeters. So, you can see that there's quite a substantial reduction and improvement. So, then the question is, well, okay, what's the safety? And we'll spend a lot of time in safety because there's a lot of misinformation floating around on chat groups and everything. And I hear this all the time. But this is what's interesting is the FDA requires a binder of several thousand pages that I was part of. And none of the none of the people putting this information out really know the information, but they're just spreading it. The information is very specific on every single patient that's been examined, what their adverse events are. And I've treated, 150 patients, more than anyone else in the world. And that's why people come to see us. It's not easy sometimes traveling a little bit longer, but we follow these adverse events very carefully and monitor everything. And then I also know what happens about amongst most of my colleagues. We're still doing phase 4 trials, so I'm still very active in that. But the data from the trial, the data from the FDA, these were the adverse events or the side effects that occurred in more than 5% of people. And muscle spasms do occur. In fact, probably even at a little bit higher rate than what's shown here. The muscle spasms are something that come on, and they typically happen at night. They're more annoying than anything else. And almost all of these treatment side effects were mild to moderate and did not lead to someone discontinuing the trial. In fact, 90% of people finish all 8 infusions. But the muscle spasms are annoying. So one of the things we often do is we'll give vitamin therapy. We have a very concierge service for offering TEPEZZA. So we can even help arrange any transportation for those flying in, but we give vitamin infusions that dramatically decrease the side effect profile of the muscle spasms. Alopecia, hair loss, nausea, fatigue were all very mild. Most of my patients really didn't notice it or notice it very slightly. Sometimes the alopecia or the hair loss was actually body hair loss, and not too many of them were bothered by that. Diarrhea can occur, and it usually is just mild or loose stools, but sometimes patients will have underlying inflammatory bowel disease. And I've heard of physicians not monitoring that well or investigating it. And it's very important to investigate that and follow that because it can be a problem and it could necessitate stopping the medication. Headache and dry skin and dysgeusia, that's just dysgeusia is just a metallic taste, usually again annoying more than anything else. Patients, especially obviously women in childbearing age did notice amenorrhea, so changing of their period, interruption of that. Again, that usually comes back during treatment or shortly thereafter. The drug remains in the system for about 3 months after you stop the infusion, so you want to make sure that you don't you don't get pregnant or anything else during that period of time. And also that can take that long for most of these side effects. Now, hearing changes is one that didn't meet the criteria here, but it did meet it in a larger trial. And hearing changes are not deafness. So everyone, I see a lot in the groups that it's causing deafness and everything. And that is just frankly false. It causes hearing changes, and what they're described as is they're kind of almost like if you get off a plane and your eustachian tube is a little blocked, you can hear yourself. A lot of my younger patients have described that comes and goes throughout the day. Some of the older patients have noticed that their hearing acuity is a little bit less. Now, again, we've done audiograms and we've seen that that seems to return, and that's what we published to the FDA, is that those things seem to be either returned or returning at the conclusion of the follow-up period for this study. One of the questions that comes up with COVID vaccines and infection, well, we'll get into COVID vaccine a little bit later, but there's no increase of infection. So this is not a drug that stops the immune system. This is a drug that specifically targets the tissue around the eye, the overexpression of those receptors, and how that is portrayed as far as the expression. That is very specific. Now, I'm spending a lot of time on the safety because I think that that's an important issue for most. We spend a lot of time with baseline testing, carefully managing patients and talking patients through this the entire way. Again, that's why patients travel to see us, and managing these side effects. There's various things we can do to make many of these side effects easy. We also, offer infusions on the weekends and such to make this convenient for patients, because sometimes it can be difficult to obtain. This is just an example of a patient who's looking straight in this photo, and in this photo is trying to look up. But on the right side, you can see that after TEPEZZA, she can now look up. Now, it did get rid of all the swelling around her eyes, but what it did is it moved her eyes back about 4 or 5 millimeters. And instead of walking around double vision all the time, she's now able to look up. And we can do a little blepharoplasty or something like that afterwards to improve that, but a dramatic improvement in her condition and what she was able to see. So, in essence, some of the points are that TEPEZZA is specific. It's specific for the tissue around the eye, and it is specific and works in both the acute phase of the disease, but also in the chronic. So if you've had the disease longer, it can cause the eyes bulging to come back in general, and improve double vision in general. Patients who are infused with us, what do they get? What's the, is there, any different? Or if you can't make it to us, what should you expect? Well, we have concierge care, meaning that, we make sure that we enroll you in copay assist and handle all your insurance obligations, etc. I have an amazing team that does that. And the second thing is we make sure that you understand what the drug can do and what it can't do. And if you happen to have any side effects, we first do all the baseline testing and make sure that we're as knowledgeable about that as possible, but then manage them throughout the course of therapy. And again, 90% of people finish therapy But if the side effects aren't managed, or if they're not watched carefully, diligently, things can certainly begin to not go as well for people, and so we certainly don't want that. TEPEZZA is indicated just for adults so far, so everyone 18 or older, but no one who's thinking about getting pregnant or within 6 months, after treatment, you cannot get pregnant also. So just those couple of things to remember. So please submit your questions also, and we can do that. So one of the questions that has come through, and one of the hot questions is, can you get TEPEZZA if you were just vaccinated? Well, the role of vaccine in TEPEZZA is still unclear, especially in thyroid eye disease. COVID in general, and the COVID vaccine also, appear to really ramp up the immune system, making flares and all autoimmune diseases a little bit worse. So whether you're getting the COVID or the vaccine, there can be increases in the actually immune system, and you could even get a flare with thyroid eye disease. Now, we've noticed, and we've come to the recommendation that we don't recommend getting TEPEZZA or the vaccine within 1 week of each other. So meaning if you get the vaccine, typically you would wait a week to give you TEPEZZA. And if you're getting TEPEZZA, you'd wait a week to get the vaccine. We think that it's fine to get during TEPEZZA. We haven't seen any negative effects. And frankly, if I were going to get the vaccine, I'd probably get it before or during TEPEZZA than after, only because it can ramp up the immune system. But TEPEZZA again doesn't appear to have any adverse effects upon the immune system, no increased infections, etc. So certainly something that we feel is safe, and the balance is reasonable. The risk and benefit of getting that is reasonable, in doing that. Another question was, there have been some reports on the support groups of receding gum line after completion of TEPEZZA. Why can make this happen? Do you think it's seen in smokers, unrelated? I've seen that in one patient of mine who complained of that. It was unclear why. She especially had a dry mouth. And I have noticed a couple patients who had very small, almost like dry excoriations in the mouth area. And that seemed to be associated. This was a very mild, case. That occurred during the trial. I have not heard much beyond that. And the drug itself does decrease growth, so it likely makes the skin a little thinner, etc. But all those growth effects that I've seen thus far have returned to normal afterwards, or have come back. And it may be that receding gums, someone's very, very sensitive to it, but I'm not seeing that widespread. Though I have seen dry mouth, dry skin, not dry eyes. Usually the dry eye is actually a little bit better after the treatment. Long-term side effects. Well, the drug has now been used for about 3 to 4 years, if you go back to the earliest trials in thyroid eye disease patients, and even longer before that. We don't know of many long-term side effects, and thus far it appears to be very reasonably tolerated for patients. So thus far we haven't seen long-term side effects. So we're just still watching and waiting. But most of the side effects, adverse events, that we've seen, certainly through the FDA monitoring period and ongoing, have gone and returned back to normal. There can be an elevation of blood sugar and worsening of even hypertension. Again, I noticed that in a few patients, about 10% of my patients. But again, that's gone back to normal after stopping the drug and clearance about 3 months after the disease process. When will it be available internationally? Unclear. It's probably a better question for Horizon. I don't see it in the immediate future, though. I know that there is work to try to make this available to as many patients as possible. Have treated a couple international patients who've flown from other countries to have treatment in our center. And so that's certainly possible. We're trying to also make inroads. I have a practice in China and trying to make that possible. But again, that won't likely be available, at least in the immediate future. Patients with international insurance, if you work for an international company, can potentially have it covered, but that would take some investigation, to that end. So I just don't know when it will be available internationally. Frankly, it's a question that gets asked quite a bit. Is it possible to get more than 8 infusions? Yes. So we just completed a study called Optic X, and that was an extension label study that we're working on publishing and getting it ready for publication. And what we found is that there are a group of patients who might have a flare who are non-responsive. And what we found is that you can treat those patients with an additional course. There does not appear to be worsening safety, etc. And I've had a patient or two now where I'm enrolling them into a second course, either due to a reactivation, which appears to be very low, maybe a couple percent at most, or it just needed a bit more therapy to continue improvement. And the safety appears to be very reasonable. Does not appear to be any new safety effects, and they were almost at the exact same rate as the safety concerns were almost the same rate as receiving it for the first time. So it doesn't appear to be anything that's preventing that. Now, that doesn't mean that insurance approval will be easier, because it can certainly be difficult enough to get insurance approval. I think, with our population, my team, who, is just amazing, has about a 98% success rate of getting people, this medication. But I know that they work very tirelessly to make that happen. And for our patients that we infuse, to follow them, make sure they have copay assist, everything that goes along with that. But so we're still, trying to figure out how easy or hard it is to get insurance approvals for those continued infusions. In my experience, next question, TEPEZZA can reduce the indication of orbital decompression, strabismus, eyelid surgery for patients. Absolutely. So we didn't specifically look at that in the study, because a lot of the indication for orbital decompression is, varies a little bit. A lot of the people in our study were endocrinologists. So, but I can tell you that we're getting a 3 to 4 millimeter reduction in proptosis, and most of those patients are not getting decompression. I've done far fewer decompressions than than I ever would. My rate has gone down probably 75% as far as doing decompressions. And remember, there's about a 56% chance that if you have double vision and you take TEPEZZA, that it will go away, meaning no need for strabismus surgery. The completely normal vision, not even double vision in any particular gaze or any time of the day. So that's amazing, and so far less strabismus surgery. Eyelid surgery, I'm not sure yet, because I think as people, do less decompression surgery and you get an improvement of the appearance, a lot of our patients kind of want a little blepharoplasty or other things. So, but it certainly definitely decreased orbital decompression and strabismus surgery. Is the drug effective in the fibrotic stage of TED? Yeah, so a lot of people use the term fibrotic as opposed to chronic, but this is kind of the same thing. And the data really is beginning to emerge quite positive. I took out the slide of, our side. Even if you're late in the disease, 10, 15 years down the road, you're still seeing a 3 to 4 millimeter reduction in the proptosis and an improvement in strabismus. We'll have to see whether that's just as good as in the early stage or not, but certainly are seeing that, and certainly is an improvement. So yes, the answer to that is it is effective in the fibrotic stage of the disease. Have to have an individual, evaluation. And by the way, we do all of our evaluations. I do most of my approvals for insurance, everything just by Zoom. So you don't even have to come and see me. We can do it via Zoom, and then you can just come in for the infusions and take care of you in that way. And that's, what a lot of my patients do. And we can take care of all your insurance needs, copay, Zoom, coordinate with your physician endocrinologist, and just come in, for an hour for the 2 hours for the infusion, and kind of be on your way, and a host of testing along the way. Is it as effective as orbital decompression? Well, I have a slide here, and I'll kind of say instead of sharing my screen again, or well, maybe I'll share my screen just for a second. That slide shows what we've seen from orbital decompression at two places where I've trained or been a professor, at UCLA and at Michigan, showing about a 3.8 millimeter reduction. In the optic study, with patients who were not even as severe, we were seeing almost the same change in proptosis. And in the more severe patients in the optic study, we saw almost over 4 millimeters of reduction. So absolutely. And in here, a third or to half of their patients were requiring strabismus, and there were no increased strabismus in our patients. So, we're treated with the medication. I still do decompression surgery, still do it every week, but I'm doing far fewer, and they're far less invasive surgeries than what previously we're doing before the advent of TEPEZZA. Is it better to wait to get TEPEZZA after done having kids? Well, that's a complicated question. You definitely do not want to have children while on TEPEZZA. So it's about a year. It's about around 6 months of treatment, and then 6 months after. So it's a personal decision at that point, because you have to decide that's a year that you cannot have kids. As far as medically speaking, it wouldn't make a difference. There's been no increase of thyroid eye disease activity, especially during pregnancy. In fact, it's probably a immunosuppressive. So medically doesn't matter, but that's kind of a personal decision, because you definitely cannot get pregnant while on or 6 months after TEPEZZA. So definitely something to keep in mind. What's the average age of people who get TEPEZZA? Do you think a lot of young women of reproductive age? And the reproductive age, I think, is a very common question. Again, doesn't appear to be any long-term effects, but definitely short-term effects as far as amenorrhea, change in periods, and having to be on birth control for that period of time. I'm not sure of the average age. It's approved anywhere from 18 above, age 18 and above, but I don't know the average age. Most of the age of my patients is in the 40s and 50s. Nationally, I'm not sure. I do have a very long conversation with young women about this, making sure that using contraception and such during treatment, because I think it's, it's such an important issue. So, as I always talk to all my patients, I want them to know all the side effects, and that we're there to help them. But this is one where, we just can't do it. And we actually do pregnancy tests before each infusion routinely, or have patients sign a waiver, because we feel that it's really an important thing that patients should know, and we would want to know, at each infusion prior to going. And we also do some blood sugar testing, just to make sure there's no abnormalities, and other testing along the way, plotting the progress and improvement, frankly, that you see during the disease. One other question is, do most insurances cover all 8 infusions? Yes, they do. And that's a really key component, is that most insurances, you have to go through a stepwise process. And it's a little harder than you may think. You have to make a justification. So most people that are denied, who come and see us, or are worried about it, come and see us, because you have to justify the use of TEPEZZA. You have to, in a very specific way, bug the insurance company to give you authorization. But when they do, they cover all 8 infusions during that period of time. And so, if you need more than that, then that might require an additional insurance justification. But they do cover all 8 infusions. And most of the time, especially enrollment in copay assist, etc., there's very little out-of-pocket cost. But we can always be very specific on your individual circumstances, in those regards, so that you know exactly what the costs are, etc. So any other questions along those lines, and we'll kind of continue to get into a little bit into the new research, some of the things that we've been doing, from that standpoint. A little bit more on how long TEPEZZA has been around. It's been studied for 15 years, not for 15 years. So the earliest studies were about 10 years ago, and that was done in cancer therapy. So blocking this receptor was thought that it could decrease the growth of cancer cells that overexpress this receptor. And so this therapy was tried for breast cancer and some juvenile cancers. The whole concept was. And that's been about 10 years in the making. It was shown that it probably didn't make a big difference there, so it was shelved. But there was a lot of safety data that was generated that appeared to be pretty safe medicine. It's just that it didn't work all that well. Then the idea came back around based upon a lot of the work we'd done of the overexpression of the IGF-1 receptor and showing that, lo and behold, this receptor is overexpressed and it may work in this disease. So it's now been going back to 2017 or so that it's been used, 18, it's been used in patients for thyroid eye disease. So there's been a fair history of about 10 years of using the drug, using drugs like this, but specifically in thyroid eye disease, about now getting over 4 years since the first patients were infused. And so that's where a lot of the safety data comes. Now, it's been used in a lot more patients in the last year since it's been released. And so we're getting a lot more safety data, which is also using a lot more patients. You hear about the rare circumstances and this or that. But the data so far appears to be very similar to what we saw for the FDA, these low rates and overall very well tolerated. Another question was, for cases with acute disease and optic nerve compression, and where we do high dose of steroids, is TEPEZZA useful? And then the second question is about smoking. So we just published and just got accepted into the American Journal of Ophthalmology a large case series of patients with optic neuropathy that all improved with the treatment of TEPEZZA. So those patients were excluded from the trials because they were so severe that we couldn't give them placebo, and that we had to make sure that they had a therapy, not just placebo. But now we just did a series of studies showing that those patients respond quite beautifully and did not need surgery and did not need other care. And that's a series, I think, of now about 20 patients who were the most severe of the severe, losing vision, going blind, and now they have been improved. As far as smoking has always been a concern with this disease, and that smoking patients are always worse. They get the disease worse, etc. We always still encourage stopping of smoking. The drug worked equally well on smokers or non-smokers. Now, we don't know if the recurrence rates are higher. It doesn't appear to be, but that we don't know. There are very few recurrences and reactivation. Most of the time, you don't get that. And in the few that we've seen, they've all been non-smokers. There weren't that many smokers in the US or primarily in Europe. So it doesn't appear necessary, but I encourage it, obviously for all my patients, because I think it somehow will increase the risk of recurrence. Even if we're not seeing the data, I would be surprised, if it doesn't. So one of the questions, how does TEPEZZA change women's period? Well, it's a growth inhibitor, so sometimes it can just make the turnover of cells a little slower. So some people will notice their nails are a little thinner. Some people will notice that the turnover, and in that case, menstruation is a time of turnover, so it just decreases either the frequency, etc., or the duration, and then it comes back after stopping with the drug. But it just kind of decreases that temporarily, on that side. And then one is it a genetic disease? Well, Graves' disease and thyroid eye disease is in part a genetic disease. But even if you look at identical twins, only 30% of them will get, if one has thyroid eye disease, the other one will get. And in relatives such as mother or father, it's even less. So there is a genetic component, but it's weak. And it's some component. we actually looked at all the twins in Denmark and did a study for the overexpression of this receptor as a marker, and found that the twin or the identical genetic makeup really didn't matter. It was the presence or absence of the disease. So the disease, in the overexpression of the receptor at least, appears to be an acquired trait. So again, your genetics puts you at risk, but it's ultimately kind of the luck of the draw, as far as we know right now, that may help to determine that. So little, comment upon, have all the questions here. Yeah. And a little comment upon some of the new research. So the new things are that we know that it changes the bulging of the eyes no matter how long you've had the disease. But we've also just put out a paper that it changes the face back to normal. Now, I do a lot of surgeries where I take away the buccal fat or I move the eyes back, etc., and really change the appearance. But we've found that actually the drug also improves those facial appearances. And so that's been a really big side bonus for my patients, is that they begin to look, like they did before. And that's really important, for patients. And, we just have a few minutes left. We'll end in about, 4 or 5 minutes. One of the, things that, patients often ask me is, well, do I have to live close to you to get the drug, etc.? And no, I can't prescribe it for you in your state. But about 30 to 40% of our patients do come in either from outside the area, fly in, fly out the same day, etc., to get the medication. And the reason why they do that is that they can set up a Zoom, webinar or a meeting, and we can get everything approved. There's no insurance hassle for the patient. They just have to wait and get approved, and they don't have any bills. They don't, come to them. We handle all that for you. Then we handle also all the pre-testing, make sure that you're followed in a very large database, so that we're following all your side effects. And we know, I speak to the company about every other day, so we know exactly what's happening with this medication in a national scale. And we treat the most of anyone, and we can give you some vitamin therapy, make the side effects better, just follow you, and make it a very easy concierge type experience. You can have a car for you at the airport, etc. Those are just things that are available. But the easy part is that you don't even have to worry about that. You can set up a consult just online and do it via Zoom and a simple webinar, and then you can kind of get the process rolling. And it's usually fairly simple. I have two great people on staff, even that, but Karen and Jenna are the stars of the show, and they kind of make life easy for not only me but for all my patients too. So they're the real stars of the show in making life easy. I just handle the easy stuff like medicine. So one of the questions, and this might be our last one, is how does it stop the disease? Does it stop the immune system, or is it just on the IGFR preventing growth? And it's an amazing question, because the answer is yes, it's both. Because what we're looking at, we're now studying the gene usage here. It stops the immune system because the immune cells specifically in Graves overexpress the receptor, so it dampens their activity, but it doesn't dampen their activity to inflammation or infection. And it also dampens the fibroblasts that are growing and so abundant. So in chronic disease or fibrotic disease, you only have the fibroblasts, you don't have the immune cells, so it works on that half. But in the early phase of the disease, it works on both. So it really is specific and targeted therapy that really goes for the disease, the disease itself, all based upon the overexpression of the IGF-1 receptor. So this probably brings us to our time. Again, this will be available for recording. Really appreciate your feedback, any feedback that you can offer us. It's very easy to get a consultation if you'd like one. We're happy to offer that. I'm on Instagram, etc., and you can just DM us, and that does reach us. Our website also has email, and then my email is raymonddouglasmd@gmail.com, and then that can get us get things directly and allow us to give you a consult. And we're always very rapid at doing those things because we want to service everyone here. But hopefully that was helpful. And again, any feedback, any other comments, questions, don't hesitate to reach out. We're always happy to help, and our team is here for you anytime you need it. So with that, I will say goodbye and thank you so much for attending.